All right, so today we're going to be giving VSTs or any sort of cells through a bag, which is slightly different than we do for the syringe. What stays the same is in the beginning of the day when you find out you're going to be giving cells, you want to look in the patient chart for a nurse's note from a care manager, and that's going to tell you when the cells are going to be coming, give you information about the patient if they're not typically a patient of ours, including allergies they may have and the type of line that they have. You want to make sure that you verify the allergies with the patient when they arrive. And also for the line, it should tell you if we need an x-ray or anything ahead of time. And then once the patient arrives, we want to make sure we have a code sheet in the patient's room hanging on the door, and we want an anaphylaxis kit as well. The patient should be hooked up to cardiac monitors as well as a pulse ox for the duration of the infusion. We also want to make sure that their line is working ahead of time. A good way to do that is we're usually going to have to draw labs beforehand, so that's a good opportunity to check that the line is working. We want to make sure that we notify the BMT nurse practitioner or attending who's caring for the patient about when the cells are expected to arrive. And then if there's any pre-meds ordered, you want to make sure those are administered, as well as any pre-hydration that could be ordered. When the cells do arrive, or prior to the cells arriving, when I know I'm going to have a patient who's getting cells and I know they're coming in a bag, I want to make sure I have very specific supplies available for us at that time. And these are things that we usually have stocked in the cabinets, or we can order them from Elm. Or we can also go over to BMT, now it's a little ways away, but we can pick up supplies from them. The specific supplies that we will need are going to be your normal cap change kit. We're going to want 4 sterile salines. We're going to want our Y tubing, which is actually going to be this right here. We are going to want 2 hub entry kits just in case. Our extension tubing, which looks like this. And we're going to want a 30 ml syringe. And maybe some additional sterile 4x4s. And our 3-way stopcock, which is the same that we use down in the OR. And maybe some additional sterile gloves are helpful as well. If you forget what kind of supplies that you need, there's actually part of the policy has a list of all the supplies you need and the numbers to order them with. And this should also be stocked with information sheets in Day Hospital. Go ahead and ask your flow lead if you want to look at that ahead of time. All right, so once the cells arrive, we want to take a set of vital signs to check on our patient, as well as have our sterile field starting to get set up when we know the cells are here. I'm going to have my flow lead assist with setting up the sterile field. And the sterile field can actually stay assembled for 15 minutes prior to the patient arriving, so that we're ready to go for when the cells do get here, we can get them started right away. All right, so our setup's going to look like this. We're going to open everything up on our sterile field except for our bag of saline and our Y piece. These we're going to hook up not sterilely, and we can go ahead and have them hanging there. It's good to have an assistant nearby just in case we have trouble hooking these up together. Everything else is going to be opened up on my sterile field with my syringe here. Now the purpose of this syringe is if it's not infusing to gravity in a fast enough time, then we can actually ask the nurse practitioner or the doctor who's staying for the duration of the infusion if they want us to do a push-pull. So this is basically a push-pull setup that we have here. So here is our normal tubing here, or actually this is going to be our special tubing because it's going to be to our gravity. And then at the end of that, we have our 3-way stopcock. Hooked up to the end here is going to be your 30 ml syringe, and then your extension piece. And all this is going to be set up sterilely ahead of time. Now I'm going to hook this up so I can prime my whole tubing to the end of this Y tubing. Now if I need an assistant, it's probably a good idea to have someone nearby in case I can't hook this up myself. And they could hold onto the one end while I hold onto the other. But I'm going to hook these up here sterilely, and now I'm good. I do need a friend at this point who can prime my tubing for me. So they're going to open up the clamp there, and we're going to prime this part of the tubing. Perfect. This is going to then be put back on my sterile field and kept sterile, and I'm now going to perform a cap change. And this cap change is just per policy as usual, and we're going to hold on to the end of our line. We're going to clean per policy, and then we're going to remove our cap as we normally would. We'll hook up the end here, and that's because the cells go directly, they don't go through a cap. And now we're all set to go. So now I can take off my sterile gloves. I don't need to remain sterile for now. And I'm going to open this up so I have this infusing to the patient as a drip, right? Okay, so we'll get a set of vital signs on the patient, and then my cells are here, so we're going to do a check on the cells. The check must include the patient's name. Make sure to spell out the patient's name, medical rec number, batch number, harvest date, product type, and unit number, which is the donor identification number. Once that's all checked with the patient and I have a good set of vitals, my assistant who's bringing in my cells can help me hook up the cells here. And at this time, I'm going to clamp here and open up my cells here. As the cells are infusing, I'm going to make sure that they're infusing in a fast, timely manner. If they're not, I will let the nurse practitioner know, and they can then order to do push-pull if needed. If that's the case, I just clamp off down here, fill up my syringe with the cells, and clamp this way and push them in. You want to make sure that you definitely clamp off your saline line for the duration of this. You don't want to mix the saline and the cells. You want the cells infusing on their own. Once the cells are almost completely infused, we want to do a little process where we do backwash into the bag so that we get all the cells. There's a separate video on how to do that exactly, but just basically we're going to push this down. And then we're going to open this bag up and open this one up so that we get a little backwash in here. Close this bag back, hang this back up, and unclamp my cell bag. And that's going to help wash out that bag so that I get every little last drop of my cells. Once my cells are completed, I will clamp everything off, or you can also have a little extra saline flow through to wash everything through. But once I feel comfortable that they've gotten all the cells that they need, I'm going to I should have a new sterile kit opened up. I'm sterile again, and I'm now going to perform just a normal cap change, right? Where we, once again, clean the site, take that off, and hook up a new cap. And this, of course, is done sterilely like we would normally do a sterile cap change. Now I can flush with saline, heparin, and I'm going to do another set of vitals. I'll document that as my end time for when the cells have completed infusing, and that's documented in our typical blood documentation form. For VSTs, the vital sign are every 15 minutes, or excuse me, every 30 minutes for an hour, and then they have that hour wait after. For our CAR T cells, it's a little bit different. It's every 15 minutes times 1 hour, every 30 times 2, and then hourly for the next 5 hours. So that's the difference with the CAR T cells, is there's more continuous monitoring afterwards. All right, and then once that's over, the patient's all set to go. Any questions, ask your flow lead, and there's some additional paperwork up front usually if you have some questions ahead of time. Thanks.